Hi, everyone. Welcome to our Distance Everything Healthcare Edition webinar. My name is Robert Young. I'm a technology consultant with Ingram Micro. I have with me Tom Mann, Dan Stewart, and Matt White from our Business Transformation Center in lovely Buffalo. And today we are going to be talking about solutions for healthcare. This is our Distance Everything series. So today we're going to be kind of going over some of the different solutions that Cisco has when it comes to distancing and healthcare. So unless you've been under a rock over the last year, you might have noticed that healthcare might be a little different. This was some changes that happened even before the pandemic, obviously accelerated over the last year. Some of the stats being that we have an aging population now. We have a much higher percentage of people that are 60 years and over. It's going to double by the year 2050 and even triple by the year 2100. Which is even weird saying out loud the year 2100, but I'm also thinking that my kids are probably going to be hopefully around to actually see that date. The other thing is we're going to have more chronic disease burden, right? So the idea that alongside obviously that aging population, as our bodies get older, they start breaking down more. So you tend to have kind of more chronic diseases that don't necessarily need, hospital visits, but might need more monitoring over long periods of time. We're also going to deal with possible staff shortages, right? With this aging population, we have, possibly a shortfall of up to 15 million healthcare workers. We either need to obviously hire into those spaces or do more with what we have, or find out how to kind of stretch those workers into kind of more positions to be able to take care of more people. The other thing is a growing patient consumerism. So the idea that our generation and even the generation past us is kind of more willing to give up some of that personal information on a consumer level, whether it's information from Samsung Health or an Apple Watch or something like that about your heart rate, EKG monitors, that kind of thing, to be able to benefit your health, from a healthcare perspective. And then obviously an increasing cost of healthcare overall. So what we need to be able to do is we need to transform these facilities, right? We need to kind of take a step back from the healthcare organizations that we have right now, and say if we were to redesign like a hospital nowadays, we were to completely redesign what a hospital is, would we have everybody connecting physically into that same location? Again, over the last year, that's changed tremendously to the point where we don't want somebody who's going in to have a baby, obviously possibly being in the exact same building and going through the same front door and checking in at the same front desk, as someone who's going in there to get a COVID test, or some other communicable disease. So we're taking a look at the physical restraints of what once was this kind of central location, right? That everyone in a town or a city would have to go to, and kind of stepping back from it and saying, if we were to redesign this, would we have that? Would we have that physical location when we have the capability to have those specialists, reach out either through telemedicine, or have these kind of more urgent care offices that are maybe more spread out, but kind of have some of the capabilities that a hospital does. So with the capability of having that technology be able to kind of bring healthcare to us, we can completely redesign the way that we look at healthcare overall. Also, from a workforce perspective, healthcare is really just the same as any other industry, right? You have the same challenges when it comes to staffing shortages, especially over the last year. We have lots of situations where there's doctors, nurses, people in these professions that are really getting burnout, kind of wondering whether or not this is maybe too much for them. We're going to have those shortages overall. Emergency medicine, which my wife is actually in, and just general practice overall of people just getting burnt out over having to do too much with too little when it comes to that.
Yeah, Bobby, this is a great overview of where we're seeing healthcare. And I think the key word on this slide here is that new solutions. And solutions is going to be something that we really need to embrace when it comes to our outlook into dialogues with our customers, with how we approach our value proposition, because one product will not solve, the business need. It's always a combination of efforts and components to, build that out, and that's, well, a solution. So Cisco, as a resource, with this, has a solutions-based area of their website. And that's kind of what we landed on here, is the solutions index, where we can go through a couple different areas and focus on what is important to us in the dialogue we want to have. Initially, you have a solutions by technology, and this is going to kind of take you into the product portfolios and expand them into a high level to then very granular components down to data sheets and tech guides and sales guides from there. So a great way to start your journey, or honestly, see what Cisco might have available, because you may be doing one area of business, but maybe not know that Cisco has a reach into a lot of different areas. You can get into solutions by business type, depending on the type of client that you're working with, or the outcome or size they want to be, or even grow to within the different categories there. But where we're going to focus our conversation will be solutions by the industry. And we can see, based on the outcome-based approach, of what type of components yielding a solution would Cisco have for these industries. So if we click on the healthcare option, we'll be brought to a resource where the Cisco portfolio for healthcare and solving those business needs from multiple areas. In our talking points, we're going to really cover in the uh, WebEx portion, the video elements, the security elements, and some distance elements when it comes to different pop-up clinics and different areas there.
That was a great overview. I mean, one of the things that I get a lot in my area, and I cover mostly collaboration products, is the telehealth, the virtual visits, that kind of stuff. So let's take a look at that one there. If you take and click on the left-hand side there where it says telehealth and virtual visits, that'll actually drop you into talking about that specific use case. And in the overview tab, it kind of gives you a nice little idea of how these are used in different environments. So these case studies are around the entire US. And the first one there, the Ava Robotics, is a really unique use case. And what that actually allows you to do is see what they're doing to help alleviate the need for that doctor to constantly be face to face with the patients. So I would say when you're taking a look at this, actually watch the video and everything, but it's a really good use case scenario of how virtual visits and remote visits can actually be utilized well in even a healthcare scenario. So really what this comes down to is a doctor wants to actually go around and visit his patients without being face to face with them. So he doesn't want to spread anything to them. He doesn't want to spread anything around. So there's actually a robotic device that actually moves around to the different patients, and it's using WebEx on the back end to actually have that face to face conversation. And each individual patient doesn't actually have to know how to use it. It's all more automated for them. So in an elderly community, they might not be very familiar with how to use that type of technology. They don't need to be. The doctor itself can maneuver it remotely. And if you actually click on the next tab, the business overview tab, that actually goes a little bit more into the different cases itself. So what are some of the drivers that are requiring this to happen? And I mentioned the one where you're really wanting that doctor to be remote, but there's a lot of other ones. Earlier on in this presentation, you showed, or you were shown a actual statistic where there's going to be less and less healthcare workers to do more and more care. And even in a lot of hospitals today, there's the need to have that expertise off site. So that way they can actually, maybe it's taking an x-ray locally, they have to actually have somebody read that x-ray. Maybe that person that's reading that x-ray is not on site. And they could then send that off to that person, have them read it and send them back the results. That's just exponentially exploding into other areas of the hospital as well. Plus you have just the regular business drivers of your day to day. A lot of people forget that hospitals aren't just taking care of patients, but they're also a business. They have to run, you have different branches that have to communicate with each other, and that's all being done over this WebEx platform or something very similar. And that's where they really need to have that communication on a reoccurring daily basis. And actually, if you click on the technical overview tab, that actually goes into a couple of the additional pieces of this. So the very top there, you can actually see how they all kind of connect to each other. And you can see that there's things involved here, not just WebEx, that are actually part of the overall solution. So not only do you have an internet connection, you also could have things like SD-WAN, you have a network in place, you could have wireless in place. So you have different pieces, not only the software, but also maybe it's the video endpoints that Cisco provides that actually get incorporated into the solution as well. And then if you scroll down even further, they actually break out the individual components of this. So you have WebEx meetings, which a lot of people are familiar with, but that really just gives you the ability to have that communication back and forth, and that can be tied into a telehealth service and actually have everything underneath the patient information. You have the WebEx app itself, and that's more designed for small one-on-one conversations, but it can also be group text messaging type conversations, or persistent messaging is what they refer to it as. And you can also share files that way and stuff like that. And then there's also the RoomKit series, which would be your actual hardware. So that could be placed in an actual patient room so that they communicate with the doctor face to face without having to actually be in the room. There's the board series, which a doctor could have at their desk in their office or at their home to do this type of communication and actually control the other device remotely using like far end camera control and those type of services. And then we also have the Desk series, which is the older series. And then there's the Share, which allows them to do digital signage around the hospital. There's the Meeting Server, which if you wanted to keep all those meetings on site and on-prem instead of having to go out to the cloud, you could do that as well. And there's a WebEx Edge, which would be actually tying in those on-prem devices with the cloud so that they kind of work in conjunction. So not everything has to be at one location. So if you have a lot of different sites around the globe or around the US, they can all still communicate pretty easily. But if there's a lot of people at one central site, maybe it's a very large hospital, they also can utilize their on-prem equipment without having to utilize the internet as much. So you can cut down on bandwidth needs because of that reason. And then you also have the integrations with other things. I mentioned telehealth, but there's other integrations as well. WebEx calling, if you actually, you don't need that face-to-face, but you want to actually have that voice interaction with people, and people are calling into a hospital, people are having to call into like a call center sometimes, those can actually be done over the cloud as well now. And then you also have things like Duo multi-factor authentication to make sure that the people that are dialing in are the correct people. So you don't want somebody impersonating a doctor or somebody impersonating some other patient. And actually, that's part of our security platform. And I'm going to have actually Tom Mann go into those a little bit more for you guys.
Yeah, thanks a lot, Matt. So security definitely comes into play really across all the architectures. Specifically, let's just go right to healthcare cybersecurity. So this will be a little more generic. However, there are, as you see on the overview here, specific case studies, just like Matt had mentioned. There's several there that you could check out. Let's just dive right into business overview here and talk a little bit about security overall here and how it affects our distance everything. So on the left, I really like the industry drivers. There's key things we want to do. We want to protect our digital assets, intellectual property, financial information, and patient data. I kind of like that last one there since I've been a patient before. Also, cyber attacks on medical and healthcare are on the rise every year. So you have to really worry about ransomware. And then the high cost of breaches to the organization. That brings us those drivers over kind of the business needs. So we want to be able to get visibility and be able to analyze and detect anomalies on the network. That's easy for me to say too. You also want to be able to enforce clinical policies and have analytics so you really know what's going on the network. And then there's the remote access piece, which we are talking a lot about today, both for clinicians, administrative personnel, business partners, and patients. If you go down to the outcomes, the business outcomes, they kind of are mirroring what we're talking about, but they're similar, like reduce costs, detect and respond to data breaches, lower risk of downtime, and then the compliance of both HIPAA, FDA, and GDPR. And lastly, if we go back, scroll up a little bit, you'll see kind of the capabilities we want to look at, not quite so much. There we go, the capabilities. So these are actually bullets talking about the solutions themselves. So to stop threats at the perimeter, we're going to get Cisco Secure Firewall running threat defense to do that. We also want to protect employees, guests, regardless of their location. So, Cisco Umbrella, their cloud-based security is excellent at that. So if people connect to the Wi-Fi, they could have Umbrella protect them from bad sites. Or if clinicians or hospital personnel, medical personnel are at home, same thing, they could be protected. As we look down here a little more, you got enforced group policies, device-based policies. We want to be able to protect the IoT devices, the medical devices. Cisco has policy capabilities too with their identity services engine. We also, not to look at them all, but we go a couple down, we want to be able to gain visibility, especially in the large organizations, on any network attacks, things that shouldn't be happening. And we could use Cisco Secure Network Analytics, formerly StealthWatch Enterprise, for something like that. So you can see how security really is important in every aspect, really, of every situation. So don't forget about it. But Dan, let's continue on to really more about the mobile experiences.
Yeah, thanks, Tom. So I would like to, double down on that security conversation because, that is definitely an important piece to everything we do in our technology life, and especially as you look at, broadening your area when you go beyond just the walls of a hospital, right? We're seeing more and more need for field hospitals, mobile clinics, and because of that, we want to do business in different areas. We want to make sure that we can bring those services to those in need where they are and not have to rely on those coming to a fixed hospital facility or resource facility. So in the same vein, we have the same kind of view of how this solution is built from an overview standpoint. Again, case studies are important to know how they were fully realized in the environment. The business overview, the ideas of why we do this, how we do this, and the need for it is important. And I think we've seen that covered from both Matt and Tom in their respective areas. And the one thing I like is the stakeholders, because as much as we're having a dialogue into a technology-based conversation, why Cisco sells great technology to solve your solution needs, we also want to know who's involved in making those decisions to innovate or expand or update their environments. And a lot goes into that dialogue. And we'll see there's, different components of different stakeholders that have different points of view in where their technology investments can best be put. So I think that's a great way to bring up that conversation. But I like using the graphical view of the technical overview of what fits and where. And in a lot of our conversations, we're finding that the Meraki platform, which is natively cloud managed, which makes it very easy to implement anywhere you want to put up a new facility. It could be a facility that's in a field hospital. Right now, we're seeing a lot of COVID vaccine areas that are coming online that need to have a way to track guests that come in. Are they at proper compliancy for people in a designated area? Are they over capacity? And technology can help that, which goes beyond just someone standing in the front of the area and doing a head count. So we can see things like Meraki Wireless gaining those analytics of details. We can see specifically Meraki cameras in their camera portfolio really gain us not just physical security to make sure the vaccines themselves are secured or the cold storage area where the vaccines are not being tampered with, but we can also see data and analytics based on users in the environment, thresholds we have created. And if we take those environments and tie it into another outcome like DNA spaces, where we can gain even more intelligence based on the wireless presence, the camera presence, the capacity thresholds, and tie that into your applications like WebEx, where if something is out of the norm, over capacity, someone's in an area they shouldn't be, we can send automated alerts through your Teams application and then make action on that, because it's not often that someone's just staring at a screen waiting for something to happen. You want to receive the insights, and we can connect that through the integration of Cisco solutions like WebEx into the reporting, into the outputs and alerts from things like the Meraki dashboards. Ultimately, we can also choose the Cisco portfolio if we want to use their enterprise platform, which definitely has another layer of things like cameras, sensors, very much a similar technology outcome, but really just adopted and deployed based on what you're comfortable with or what might be already deployed in your infrastructure that you want to extend to remote sites, clinics, field, or otherwise. If we scroll down from the technical overview, to continue that conversation, it gives us a nice recap of all the products and components that were leveraged in that graphic that we could deploy for Cisco-based deployments, Meraki-based deployments, and some things like collaboration and even things like security will reach cross between these two to integrate these solutions even further into a desired outcome. Speaking of outcomes, where can we learn more about these technologies? And I would say the best place to talk about that is really in our Ingram Micro Business Transformation Center. So all of us here that are on this call work with this great resource in our Buffalo campus of Ingram Micro, where we take the technology we've seen in these solution outcomes by Cisco and have them on display. The tele solutions that Matt was talking about with WebEx, we have that equipment, we have the capabilities, we can showcase how that works in a proof of concept type manner. The security offerings that Tom was talking about with using cloud-based security, things like Umbrella or Duo, we can bring that and show those demonstrations working to achieve that end. And of course, Meraki is present across our center with the physical security cameras. Recent additions was some of the IoT sensors in our facility as well to go in and maintain and monitor environment variables, which are key to any healthcare opportunity. Think of cold storage once again. And then we can use that for data analytics and things like DNA spaces for location benefits, asset tracking, things of those natures are on display. We have the technology in our environment to help showcase with you to achieve that outcome through our demonstration capabilities. Now, we are open. We are virtual, so even though as exciting it might be to come to Buffalo, New York, and the current state of the climate, we can still be accessed, we can still be reached, simply going to our Imagine Next website, Business Transformation Center, and ask to schedule a demo. And we can actually walk through one of the areas in our center, which is a next generation healthcare facility. And we have this technology and other solutions on display delivering that outcome for your benefits with healthcare or even other technologies that might be out there. Lastly, just want to bring up our Cisco Virtual Learning Series, which is another area where we can continue to educate and inform all the capabilities of Cisco and Ingram Micro across our investment and visibility to you and your customers' outcomes. And we have them delivered through blogs, podcasts, video on demand. A lot of great resources can be found at our virtual learning series that helps you achieve your Cisco ultimate goals.
Well, thank you, Dan, Tom, and Matt for some assistance in our overview of Distance Everything, in this case, solutions for healthcare. Please reach out to us with any needs you have, as Dan mentioned, and hopefully we'll see you on the next one. Thanks very much.